Hello, my name is Dr. Abigail Pamich and I'm a clinical psychologist. I'm going to talk to you today about overcoming overeating. We're going to think about the emotions and thinking. So to give yourself every chance of success, it's good to be equipped with tools in each of these 4 areas. Third area is emotions. Now, if I had a client in front of me in therapy, we'd go a lot deeper into this area, but I'm just going to touch on it today. Often that sense of when we want something is kind of like an agitation. We're not deeply hungry at 6 or 7, but we just fancy something. What's happening there is we're actually having an emotional reaction. This emotional reaction can be a bit of anxiety, a bit of anger, a bit of worried. We're feeling agitated. There's a discomfort there. And we're reaching out to food because it's soothing. It feels nice. It tastes good. We have a burst of something good. Now that's a very strong relationship to have with food, and often people, we call them, they eat their emotions. If they feel really, really sad or really low, they will eat to try and get rid of those feelings. So one of the things that it's important to do is to notice if you're doing that. Are you eating when you're not really that hungry? Well, what's happening? Name your emotional state. Just stop a minute and go, actually, what am I feeling right now? You might notice that you're feeling worried or that you're feeling angry about something, and name that and actually say, okay, I'm feeling a bit anxious right now. I've noticed I'm doing this so much more in the lockdown, where I would go for a while without feeling tempted to eat these sorts of snacky foods, but because of feeling anxious and seeing things in the news and so many changes and my own personal worries about the virus, that I'm just reaching so much more often for these sweet foods. And it's an emotional response. I'm looking for emotional soothing. So if you're experiencing this, just notice that you're doing it, name what the emotion is, and listen to it, because 2 things about emotions. Firstly, is there a signal? So ask yourself, is there something that I need to attend to? Am I angry about something? Do I need to figure it out? Am I anxious about something? So listen to it and look if there's anything that you need to do. And if not, look at other ways to soothe, because this is not hungry, this is needing soothing. And this is what we do in therapy, go into it a lot deeper. But it's very, very powerful way to stop this extra kind of eating that really is just about emotional soothing. So different ways you could soothe is really personal, but it could be speaking to somebody, it could be journaling, it could be reading a book, it could be distracting somehow, watching a comedy, but something else, recognizing that you are feeling a level of distress, naming what that is, looking if there's anything that needs to be done about that, and then if not, using soothing in a different way rather than going to food. So the 4th and final area is to think about our thoughts. So in psychology, we understand the way we think drives the way that we feel, which drives the way that we behave. So they're all interconnected. So if we're looking at tools for overcoming overeating, the most success is if we work in all these 4 areas. So thinking, again, I'm just going to touch very quickly on thoughts, because in therapy we'll go a lot deeper into this, but there's certain type of thoughts that are really unhelpful. All or nothing thinking, for example. Okay, I've broken my healthy eating, I've had a biscuit, I might as well have all of them. And this sort of giving up, I don't care for myself, I'm not worth anything, I don't value myself, I'm just going to eat whatever I want, I don't care. So these kind of thinking patterns actually drive us to feel low and drive us to not put in healthy behaviours when it comes to food. Also, catastrophizing is another thinking pattern that we know is really unhelpful. So everything's terrible, everything's going to go awful, overestimating the danger and the bad things that are going to happen. So again, these thinking patterns are really important to get in touch with, because they drive the whole sort of train of this kind of overeating. So for the sake of this video, something you could do is actually think about, okay, well, what kind of thoughts do I want to have about food? How do I want to be? Maybe devise a goal of how you want to be, whether it's staying healthy, staying a healthy weight, doing exercise, all those sorts of things that make a healthy you, and attach thoughts that I want to be the best person I can be during lockdown, or during this life I want to be as healthy as I can be, and then repeat those thoughts to yourself to try and influence your emotions and then your behaviour. Often these thoughts, again, this is why we go into it more in therapy, come from childhood, and it can come from things that we've said, it can come from trauma, it could come from stuck beliefs. But what I'd like you to take from this video is that the thoughts are so important, and they can have peripheral automatic thoughts, or they can go really deep to core beliefs. If I don't have value, I'm not worth looking after, I'm not worth caring for. They go very deep, and we can work on them in so many different ways in therapy. But if you can just be aware that certain types of thoughts are going to drive this whole pattern. So stop again and think, what am I thinking? Am I thinking I don't care? Everything's terrible. There's no point anyway. And those, and are there any different thoughts you can have, and maybe write those down and see if you can just say those over and over. Even if you don't believe them, sometimes it's healthy just to say them, like, I want to stay healthy. I want to look after my body. Things are going to work out. I can care for myself and soothe myself in different ways without food. My name is Dr. Abigail Pamich. I'm a clinical psychologist and I'm the clinical director of Malvern Hills Private Practice in Worcestershire. If you need to contact us, you can visit my website, drabigail.co.uk. Also, the website of my team is malvernhillsprivatepractice.co.uk. Thank you.